been waiting for weeks. You have a million questions. Finally, it's time for your first prenatal appointment. This visit is usually the longest one you will have during your entire pregnancy. It can be intimidating if you don't know what to expect. Will they do blood work? Will you see the baby? Today, we're breaking down the typical booking appointment agenda. The history interrogation. Get ready to talk. Your provider needs to know everything to assess your risk level. They will ask about your menstrual history, past pregnancies, including miscarriages, family genetic history, and your partner's health. Tip: write down the dates of your last period and any medications you are currently taking before you go in. The physical exam. It's a full checkup. They will check your weight, height, and blood pressure to establish a baseline. Expect a pelvic exam and likely a pap smear if you haven't had one recently. They are checking the health of your cervix. The lab work. Hydrate before you go. They will take several vials of blood. They are checking for blood type and Rh status, positive or negative, iron levels, anemia is common, immunity to rubella and chickenpox, STIs, and other infections that could affect the baby. The dating scan. Beaming, excited. This is the highlight. Many doctors will do a dating ultrasound to measure the baby, crown to rump length, and confirm your due date. Be aware, at 8 weeks, the baby is tiny, so this is often a transvaginal ultrasound, internal wand, not the one on your tummy. Questions to ask. Don't leave without asking these 3 questions. Is there a 24-hour nurse line I can call if I'm worried? What over-the-counter medicines are safe for me to take for headaches or allergies? Are there any restrictions on my exercise or work based on my history? You'll likely leave this appointment with a goodie bag and a picture of a tiny gummy bear baby. Next up, we have to talk about the hard stuff. How to survive morning sickness without losing your mind.